Hello guys, welcome back to No More Cavities. Today we are discussing the posterior view of the skull. First we will discuss the suture present in the posterior view of the skull. This suture present here is known as the sagittal suture connecting the two parietal bones. While this suture present here is known as lambdoid suture connecting the parietal and occipital bone. This suture present here known as the parieto-mastoid suture connecting the mastoid and parietal bone. The sagittal sutures ossify between the age of 20 to 30 years. This thing present in the purple is known as the palatine process of maxilla. This foramen present here is known as the incisive foramen, found in the midline posterior to the upper central incisors, housing the nasopalatine nerve and the greater palatine vessel. This thing present in green is known as the palatine bone. It is a paired L-shaped bone forming the part of the nasal cavity and hard palate. Palatine bone is located between the sphenoid and the maxilla. This whole bone, as we know, is known as mandible. Mandible have different parts. This thing is known as the ramus. This is the body of mandible. These are the angles of mandible joining the ramus and body. The mental spines, the sublingual fossa that will house the sublingual gland, the mandibular foramen, and the mylohyoid groove. This is the mandibular foramen housing the inferior alveolar nerve, a branch of mandibular nerve. It also houses the inferior alveolar vessels. The mandibular foramen is located on the medial side of the ramus. This is the external occipital protuberance, giving attachment to trapezius muscle. This is the highest nuchal line, giving the attachment to gallia aponeurotica. Below the highest knuckle line present is the superior knuckle line, giving attachment to occipitalis, splenius capitis, trapezius, and sternocleidomastoid muscle. This is the inferior nuchal line, giving insertion to semi-spinalis capitis muscle. These are the occipital condyle that are kidney-shaped, forming the atlanto-occipital joint. This present in yellow color is the pterygoid process of the sphenoid bone. This was all about the posterior view of the skull. Thanks for watching.